If you want to know how to minimally invasively, predictably treat tetracycline cases and achieve maximum aesthetic results, you're in the right place. Dr. Bud Mopper, a fellow of the American Academy of Cosmetic Dentistry, is going to show us exactly how to do that. And we're starting right now.
And now, Amazon #1 best-selling author, Dr. Tom, the Gems Guy, Orent.
Greetings from Planet Gems. I'm Dr. Tom Orent, aka the Gems Guy. If this is your first time here on the planet, welcome to the Dental Goldmine. If you're a subscriber, welcome back. As part of our ongoing series, Gems of Dental Clinical Mastery, I have the honor of presenting my friend and mentor, Dr. Bud Mopper. He's a member of the Academy of Aesthetic Dentistry, a fellow of the AACD, and he teaches postdoctoral continuing education, direct resin bonding at many major universities. Dr. Mopper received the Lifetime Achievement Award from the World Aesthetic Congress in England. He's the Director of Education at the Center for Aesthetic Excellence in Chicago and is co-founder and chairman of Cosmedent. He's my friend and mentor. Buddy, thank you so much for being with us here today.
Well, it's nice to be with you people again. Nobody believes in bonding more than I do. And I know how effective it is in certain areas. And tetracycline, if I can, there it is, right here. Tetracycline is an area where stain is an area where it excels. Far past porcelain, I can tell you that much right now from personal experience. If you know how to do it, and it's simple, and it's faster than doing porcelain. It's repeatable. But you got to know what you're doing, okay? And this will explain a lot about what our system does because it's so repeatable, okay? But there are certain things in it. There are things that we developed that we had way before anybody else. In fact, we're a lot of firsts. If you want to know the truth in dentistry, I'm just telling you right now. We're the first ones ever to match the Rita Shade Guide. We're the first ones ever to put fluorescence into our material. We're the first ones ever to make a genuine colored material. We are the first ones ever to make instrumentation that really works so that people could work with these materials. We're the first one with a mylar back disc that really worked, that had resilience, so they've got snapback, and then later on other people followed us. So we got many, many firsts as a small company, and I'm very proud of that. Maybe it sounds like an ad. If it is, well, I will make no excuses for making superior materials. There are other materials that are out there, but I can make you a lot better if you're using our material. And I'm telling you right now, that's for sure. Okay? So now let's go into tetracycline stain. Let's take a look at this case. This is a case that was for years this way, and you'll see what happens to this lady, okay? She's been trying to have these teeth done for years and years, and finally she got porcelain laminates, and this is what she came into my office with. It's a disaster. So let's see what we can do with it. Take a look at the lips and the thing, and he's got a greasy lipstick on there. We'll talk about that when we get done with the case. In the meantime, take a look at what she looks at the smile. On profile. I'm just showing you that she goes all the way back to her premolars, and she should. And you can see she had orthodontics done. She's missing a premolar on the right side. All right. Okay. So now let's take a look at what I see when I take it off. So here's your tetracycline stain tooth. Now, if you look at the patient's left central, okay, I have completed the underlayer. All right. How did I do that? We'll show you how we did it by doing the next one, okay? But why am I doing two teeth together? Because tetracycline varies from tooth to tooth. So I want to make sure, especially with the centrals, that the undercolors are the same, okay? So that when I do that, they match completely in color, as close as we can get. So I'll build these side to side. So I built this first one, the undercolor, polished the proximal so it can't stick. Remember before, if you watched me, I'm not putting the strip. I'll put the strip in there to etch. After that, I'm going to remove that strip, or the mylar strip, or whatever strip is in there, because I don't want it in there. I want to be able, now you see the titanium coated instruments that we developed. I want to be able to get into that on a proximal and carve it finitely as I can. And you'll see the results, both in tissue response and in the two structure when we do that. So now we've got the first one done for the underlayer, okay? Now, how do we do that? How do we get rid of that? How do we bring up the value? Well, we developed, and we were the first ones ever to do this. Nobody developed it until about 10 years later after we did it, was pink opaque. And our opaque is superior to everybody's. In its flow, in its adaptability, in its color, and everything else. And why do we use pink? Because lab technicians had known for years that pink would neutralize gray and dark stains. And so I read about that, and I said, you know what, I think I can make that. So I gerrymandered it in my own practice, then sent it to our chemist, and we made a pink opaque, which is a paint-on. And it's a pre-opaquer. It's meant to pre-opaque anything before you go through the rest of the system to bring up value without overdoing it. If I were to use white down there, either the lesion or the restoration would end up too white or maybe gray out, okay? And there isn't any other color that works. Pink neutralizes beautifully, okay? So we're adding the pink opaque and we're blocking it out. And once we've done that, we add the pink opaque and polymerize that. Then we overlay it with microhybrid because that blocks out better than anything else in ultra thin layers. And that's the beauty of the microhybrid is its wettability. If I put it in a size ledge, it'll have a little bit too much slump. So in bigger areas like that, I might use a nano. Everything adds to the way it works for you, okay? But when I'm doing ultra thin layers of blockout, the microhybrid is unbelievable. Once I got that on and placed, then if I see dark areas where I need to enhance even more, I might go to the opaque of the color of choice. So it goes pink opaque is a pre-opaquer, then the microhybrid, then the opaquer, the color of choice to get complete blockout and match the adjacent tooth undercolor. Okay, so once we've done that, now I want to bring in some gingival hue, so I'm going to bring in my tint. Why am I using tint? Because tint will shine through the microfilm. It won't shine through a nano, but it shines through the transparency, translucency of the microfilm. So I use this ochre tint at both gingivals, polymerize that. Then I go to the incisal, create the illusion of incisal translucent, and now you can see there's a variation from the incisal to the mid to the gingival cervical area. And I will polish that. I can't stick to the other surface, okay? So at that point, now I will polish that surface, and then I'll apply the microfilm to the adjacent tooth surface because it can't stick. You see, because I polished the proximal of both those in the embrasure space areas of both those surfaces, so it can't stick. So now goes the microfilm. There's no strip in there because I want to define that area in approximately get intimate contact of one tooth to another. So now on goes the microfilm. And I will place it, I'll tap it with my finger, and I'll shape it, and I'll use broad-bladed instruments to apply it. This is an application instrument. And you can see, I'm tipping the blade, bending it towards the incisal edge, bending it out, sculpting into the gingival areas, into the proximal areas, transferring to an 8A, which is a little thinner, but it's still a broad-blade instrument, still an application instrument. Actually, we spread it like butter. We don't compress these instruments, because if you do that, you'll get pullback. You don't want to just slide along the material and finesse it and cleave it. Finesse it and cleave it. And now I've transferred to, on this lower slide on the screen, you can see I've transferred to an ultra thin layer instrument, which is called our IPC. It comes in straight blade, comes in short, long, comes in off angle, it'll get you anywhere you want to go. But it's so great because you can go finitely underneath the feed margin without violating the gingival attachment, and you can sculpt in approximately and define those areas. If you don't have instruments like this, you can't do this work. And like I said always, the most important aspect is creating the morphology, because if you can't make a tooth like a tooth, you've got a problem. Color is one thing, but you still got to make it look like a tooth. That's the most important thing. So we're sculpting, cleaving off the excess, defining the embrasure space, rounding out the line angles, and I wanted to create a little bit of more incisal trans in this one. So at this point, I've got it sculpted the way I want it. Now I'll take my multi-purpose instrument and I will define the incisal edge and I'll intersculpt those areas, okay? You can see. as we're doing. We're intersculpting those areas. Once we do that, we polymerize that, and it leaves room for incisal translucent material. In this particular instance, I use light incisal because it's a very light tooth. I think we use, in this case, we use SB1, which is a super bright shade, which matches the OM shades of the Vita shade gun. Sculpting it, shaping it, blending it in, making sure we get that in those crevices. You could even use incisal flowable if it's deep enough, and then polymerize that, and then put the paste material over it. You want to make sure there's no pitting. If you're going to get pitting anywhere, it's when you intersculpt those areas and you go ahead and polish it back, you may get voids in there. You want to make sure you don't. Now, the big thing, like I showed you on the cervical restoration, is to close down the gingival tissue margin, a gingival cervical margin. And we're going to close that down with another ellipse of material, against the pre-polymerized materials, sculpting it up into the interproximal area, blending it down beneath the pre-margin, going from distal to mesial, sculpting it into the body, and that's the way it looks when it's placed. Now we do the second one. Next to it, we polish the proximal surface again, so it can't stick to the adjacent tooth. And now I can apply the microfill. So I apply the microfill. So we're doing two teeth at the same time. You can see I've got my glove up here, and I may tap that with my gloved finger. And it's the same thing, sculpting, shaping, getting it underneath the margin, intersculpting the microfill, placing the incisal. And between each one of these layers, if you've intersculpted, don't put your incisal in before you polymerize, because you'll mess up everything. So I put in my incisal, sculpt in my gingival, shape it, and look at the attention I'm paying to detail. The proximal areas are perfect because in my sculpting. You don't get it perfect, you're going to have a mess when you go to polish. That's what you don't want. Okay? So now we got them both in place, and we're ready to finish and polish. And once we've done that, I'm not going through the polishing technique because I've gone through the polishing technique. I go through my discs, my ET burrs, my strips, and everything else. But once I've done that, you can see the contour that we've established with those teeth. Well, on the other series with Tom, and if you go into our series in Confident, we'll show you how to finish and polish these things. It's easy to do, but it takes some know-how, okay? But in the meantime, if you've never seen what we do, so in the meantime, you take a look at the finished product. She still got that greasy lipstick. I tried forever to try to get post-op slides. I couldn't. But here's the thing I want to show you, okay? We started there. We finished up immediately there. Look at the blunted papilla, okay? There's the blunted papilla. And this is the look that you get. And look at the smile line. We brought her out right into that smile line, following the lip. Okay, this is all part of smile design. We're on midline, okay? The symmetry is great. Now, I don't measure. Everybody says, how do you get the symmetry? You can go in and look at books or measurements and stuff like that. I've got a trained eye. I see the symmetry. I see the sizes. It's just the way it is. I don't need an articulator. I don't need it. If you need it, use it. I'm not telling you how to get there, but I'm telling you how I do it. And the way I've always done it. And when it comes back in a year, take a look at it, both uppers and lowers, but look at the papilla. We've grown papilla. Take a look. That's the way she finished. The upper. Then I did the lower also, okay? And when she comes back, that's the way she finished. Look at the health of the gingival tissue. This is a year post-op. Look at the papilla that we've grown in there. And it wasn't a periodontist. We did it because we marginated beneath the pre-margin perfectly with no ledging. And secondly, because we got within 5 millimeters of bone, which Coy Santano talks about. I didn't know that at the time, but that's what happens. And take a look. Look at the tissue health. Look at the pink. Okay? And then let's take a look from proximal. I mean, you can see the development of the incisal translucent. It's subtle. That's what it should be, going towards the gingival. And this is the way a young lady started. It came to me. And this is the way she finished at a year.
That's got to be one of my favorite cases, looking at where she started and where she is now. It's just a spectacular look. She must have been thrilled.
She was. And what she had gone through over the years, she's such a lovely young lady, and she's one of my favorite patients. And I can't tell you how she feels about me, and how this. I get response. You know, I've been out of practice for 3 years because I developed a essential tremor. Actually, I could tell you a story. I don't have it anymore. It's amazing, but that's something in itself. But I would love to go back to practice. I probably won't. I'm 83 years old, but I will teach, continue to teach. But the people come to me. I go to concerts. I go to movies and everything. Every time I go somewhere, there's somebody that comes up to me and says, "Look at this. You did this 25 years ago. Or you did my child 25 years ago and still there." You know how it makes you feel? It's unbelievable. So nobody's going to tell me this is second-rate dentistry. That's what they've done it. This is what it's taken second place to all the invasive procedures that they do. Want to know something? I'm better than that. I'll put it up against anything, from long-term to all the way through, and repairability and anything else. And would I charge for it? You bet I'll charge for this. And you should. And you don't forget, you don't even have lab fees involved here. Okay? No lab fees. You've done it yourself. And you've got the control.
As I say, it's amazing work. The fact that you do it non-invasively, you preserve their natural teeth, and yeah, you change their outlook on life. You can tell just from looking at these 3 photos how she feels about the way she looks now. It's just amazing. So, buddy, thank you so much. This was beyond all expectations.
Well, it's my pleasure. You know, I enjoy doing it. I got a lot of neat stuff, so eventually we'll go through it. I got a technique called the smile as an eye opener. And you got to see that too. It's about an abused woman, and you can't believe the change. And it's unreal what you can do with this stuff. You can work with cleft palates. You can do. There's so much stuff that you can do. It's unreal. First of all, it gets you to think out of the box. I've got a thing that shows out of the box. It gets you to think out of the box. I'm sure there's very young people out there that are so inventive. They'll say, you know, I got another way to use this, Dr. Mopper. And they should, because every time you look around, there's another way to use this material. And that's why I love it so much.
Just amazing, and I appreciate your saying next time. We'll definitely have a next time, and be well, and thank you again.
You're welcome. Take care, everybody out there. Bye-bye.
If you found this video helpful, subscribe to the channel and hit the bell notification so you won't miss a thing. If you're not yet a GEMS family member, Elizabeth and I would be delighted to help you build your practice and your revenue. We'd love to have you with us here on Planet GEMS for a time-limited offer, a free test drive of GEMS family membership. Go to dentalgoldmine.com. There's a link in the description below. If this was helpful, click like. And thanks for joining me here on the Dental Goldmine. And remember, you're only one gem away.